Assalamualaikum warahmatullahi wabarakatuh. We are from group 3. We present about euthanasia or mercy killing. Euthanasia comes from the Greek words which eu means good and thanatos means death, and it means good death or mercy killing. So it means the act of inducing an early death, usually referring to acts which terminate or shorten life painlessly in order to end suffering where there is no prospect of recovery. So it is the act or practice of ending a life of a person either by a lethal injection or suspension of medical treatment. So by definition, euthanasia is an act or practice of painlessly putting to death persons suffering from painful and incurable disease or incapacitating disorder, or allowing them to die by withholding treatment or withdrawing artificial life support measure. So there are three types of euthanasia. The first one is active euthanasia, whereby this is a direct action to accelerate a person's death by injecting certain drugs that can be immediately fatal. The second one is passive euthanasia. This is an indirect action to accelerate a person's death by stopping food, water, medicine, or procedure that are necessary to continue a patient's life. So this patient will be left without any treatment until he died due to the illness he suffered. And the third one is voluntary euthanasia. It is called voluntary because it is a person wishes to stop his life based on his own request, either orally or in writing. So from the video, there are two situations. The first one is the patient suffered from cancer stage 4, so she requested the doctor to stop her life by giving her a drug. And the second one is when the patient is in comatose state or brain death and the family members requested to stop the life support. So the issue here is it permissible to stop someone's life in any of these situations?
Is brain death considered as being dead? In a medical world, brain death is a term used to define a clinical condition of the permanent cessation of complete brain function, including the brainstem, where the patient will lose all brain function, including the control of involuntary actions. However, in brain death, they need confirmation by two specialist doctors who are experienced in diagnosing brain death following strict conditions, which are diagnosis of irreversible brain damage is absolutely certain, totally unreceptive and unresponsive, brainstem reflexes are absent, and loss of inherent ability to breathe. Before we discuss further on this issue, we will first discuss the rulings regarding killing from the Islamic perspective. It is prohibited for Muslims to kill anyone, and it is considered as one of the greatest sins in Islam. This is in accordance with the statement of Allah subhanahu wa ta'ala in Surah Al-Isra. Do not kill any persons the life of whom is sanctified by Allah, except for a just reason, and whoever is killed unjustly, we have invested his hair with authority of equal retaliation, but he must not cross the limit in the matter of killing. Surely he will be helped. In Islam, life and death is determined by Allah, and thus a person does not have the rights to end his own or others' life. So, when discussing the issue of brain death, the biggest concern would be whether it is permissible to stop or switching off the life support system that the patient depends on to stay alive. Thereby, regarding this issue, there are two opinions that should be analyzed. Firstly, the opinion that prohibits stopping or switching off the life support system with the reason that brain death is not considered as death in accordance with a statement of Allah subhanahu wa ta'ala from Surah An-Nisa, and never is it for a believer to kill a believer except by mistake. Then, these are the list of scholars who support the first opinion. The same is mentioned in another statement of Allah subhanahu wa ta'ala we stated from the previous slides, where there is a clear prohibition of killing another human being. The reason is a person is considered still alive as long as his heart is still beating, even if it is with the help of machines. In another verses of the Quran, Allah subhanahu wa ta'ala states from Surah Al-Kahfi, verse 9 to 12, Wajh al-dalalah, which means the indication of the evidence of when Allah subhanahu wa ta'ala said, Ba'athnahum, which means we awakened them. This phrase becomes the evidence that supports even if one's senses are lost, he is not considered as dead. Moreover, according to fiqh, which means established certainty is not removed by doubt. So, for instance, death is not a certainty even if his brain has stopped functioning, for the person's heart is still beating, which is the cause of the doubt. Hence, no one can be certain that someone is dead unless he has really died, meaning that all her physical functions have stopped, which includes the beating of his or her heart. Other than that, in fiqh, it is also stated that, which means the original ruling of something is its original ruling, which means the permissibility. Therefore, a sick person is originally alive and will remain alive until his soul departed from his body. Moving on to the second opinion, where the opinion that ruled brain death as death and it is permissible to end his or her life or forsaking treatment. A hadith from Amr bin Maimun during the incident of the stabbing of Amirul Mu'minin Umar bin Al-Khattab radhiyallahu anhu. Then an infusion of dates was brought to him, and he drank it, but it came out of the wound of his belly. Then milk was brought to him, and he drank it, and it also came out of his belly. The people realized that he would die. Sahih al-Bukhari. Companions at that time no longer tried to treat Sayyidina Umar radhiyallahu anhu, for they know there are no hope for him. This story is an evidence used to support, indeed, life is but borrowed time, and as if it never existed. The National Fatwa Council of Malaysia decided that in the medical field, brain death is considered to be death, and when the death is confirmed by the expert, then it will follow all rulings relating to death set by the Sharia. Hence, it is permissible to stop the support assistance treatment with the consent of the next of kin after being confirmed by two physicians who are not involved in the organ donation deal. Last but not least, we proceed to the dimension of euthanasia according to Islamic perspectives. So, according to Dr. Yusuf Al-Qardawi, he explained that active euthanasia is illegal in Islam. He stated that euthanasia is an act of killing, and killing is a major sin and thus forbidden in Islam, the religion of pure mercy. However, Al-Qardawi described passive euthanasia is permissible in Islam. He stated that as for the suspension of medical treatment via preventing the patient from his due medication, which is, from a medical perspective, thought to be useless, this is permissible and sometimes it is even recommended. Thus, the physician can do this for the sake of the patient's comfort and the relief of his family. Nothing is wrong in this method. So, some form of passive euthanasia include withdrawing medical treatment from terminally ill patient, withholding medical treatment from terminally ill patient, pain medication that may hasten death of a terminally ill patient as a side effect, discontinuing life support system such as by using the ventilators, refusing medical treatment to terminally ill patient, and also do not resuscitate, or known as DNR.
To summarize, after analyzing and acknowledging both opinions of scholars regarding this issue, in our opinion, brain death is considered as death. The reasons of our opinion are: firstly, scientific studies in medicine have shown that in some cases, brain death results in the cessation of all primary functions of the brain, where the patient can no longer respond to any type of stimuli. After the assessment is done by specialist doctors, then the patient will be certified as dead. Secondly, fair and trusted medical experts have confirmed total failure of brain function. And thirdly, those who suffer from a brain death are dependent on the life support machine. Hence, we are inclined to state brain death is considered as death following the strict guidelines and conditions set by medical experts. In conclusion, according to Islam, a doctor or healthcare provider should not take away life or help in assisting anyone to end his or her life, even when he or she is motivated by mercy. This is prohibited because this is not one of the legitimate indications for killing. Therefore, active euthanasia and physician-assisted suicide are forbidden in Islam. However, in some cases, such as in brain death, withdrawing medical ventilation from patients is permissible. That's all from our group. Thank you.